What exercises can increase back pain? This is a really important topic. I think it's something that's not really talked about. It's not out there. By the way, my name is Dr. Ryan Peebles. I've dedicated the last 20 years of my life to better understanding and reversing the root causes of chronic lower back pain. If you have a lower back issue, the types of exercises that are going to irritate it are typically ones that are going to be doing the opposite of what those tight lower back muscles are trying to do, which is to brace the spine, to prevent further damage. Stretching tight muscles that are tight because they're protecting is potentially contributing to the cycle of the back pain problem. I believe this can be really helpful to you if you can grasp the concept that I'm about to teach. So now, what happens to the body? What happens in the body when the spine is irritated? We get tension in our lower back muscles. They tense up. And so we feel muscle stiffness and tightness in the region of the lower back. I do believe one of the first things that the body does in response to aggravation or a potential danger or even damage is it tightens up. And so that is a very important thing to pay attention to. Pain is another immediate response, just like the alarm system, right? And along with that is the protection. So the alarm is stop doing whatever you're doing, and the next thing is the protection. I'm gonna tense up the muscles around the joint, and the body is saying, I'm gonna tense it up and try and prevent further damage from happening. And so that's to stiffen everything and to stop it from moving. That's the kind of the immediate response, and that's the inflammation response. When we feel this, if we keep in mind, okay, the body is doing this for a reason. What is that reason? Why do the muscles tighten up? It's to protect the spine from further damage. This is what we want to keep in mind when we're doing exercises for the back. If we have the response to these tight muscles of stretching them because it feels better, we are doing the opposite of what the body is trying to do, which is protect that area. By stretching the muscles that are tightening up, we are undoing the protective mechanism, the body's own brace around the injured or potentially injured area. And it may feel better for the muscles. That's the thing, is the muscles like movement, they like blood flow, they like to get that oxygen. And so you may feel better from doing the stretch in the moment of doing it. But what's happening deeper inside, underneath the muscles to the spine, may be aggravating it more. And what we want to do instead of doing exercises that move the spine is we want to try and stabilize the spine by providing more support, and not so much with the muscles that are already tensed up. Those muscles are already doing their job, but the back muscles are the ones that typically tighten up. But there's 270 degrees more area around the torso of muscles that are not tightened up as part of the protective mechanism. If we can stabilize those muscles and bring in a little support for the back muscles, then the tight back muscles may be able to let go, may feel safe to reduce the amount of tension that they are holding in order to try and protect. This all kind of ties into the cycle that we deal with, because if you irritate your back by doing exercises, or even it could be just activities of daily life, then we have that protective mechanism of tightened muscles, which then leads to more imbalances. And if you have muscle imbalances and your joints that are out of alignment, then most exercises are going to irritate it through friction, vibration, force, impact, whatever you want to call it. If you have muscle tightness and stiffness in your lower back because your muscles are trying to protect your spine from further damage, if we then go ahead and try and stretch these muscles again to try and get that relief of that muscle stretch relief, then we're just putting ourselves through the cycle. I hope this lands for you. Let me know, does this land for you? The best thing that you can do is gentle things that bring your body back into balance, to bring the joints back into alignment. Walking is one of those things. Walking is a full body, healthy movement. Getting down on the floor and doing, the stuff laid out in the program are those things. And you have to build on those things to build up your body's tolerance, to be able to do more things, to more resilience to the friction and the things that we like to do in our natural life, in our daily life, like activities that we consider fun, like playing sports. You can build up to be able to do those things in the future, but if the body's out of alignment, it might not be able to tolerate it right now. And so that's why it's got to be a gradual progression. But it has the potential to have a major impact if you can grasp that stretching tight muscles is undoing what the body is trying to do. They are tight for a reason. And this is in particular case. In some cases, stretching can be very good. If it's general tightness from lack of movement or, immobility, that's great. But if it's a response to aggravation and irritation, if it's the body's inflammation response or protective response, then I do not think it's a good idea to undo that response by stretching those muscles and potentially causing more of the repetitive trauma that was the original problem. We will be back again next week with another topic. Until then, go do something healthy for your body. If that means going for a walk like what I'm about to go do, then do that. And if not, find some time to get down on the floor and connect to your core.